Serotonin, melatonin, and niacin are synthesized from what precursor? A. L-tryptophan. B. N-acetylcholine. C. The answer is A. L-tryptophan. Serotonin, melatonin, and niacin are all synthesized from L-tryptophan, an amino acid prevalent in many foods including chocolate, oats, dates, milk, sesame seeds, eggs, meat, and cheese. L-tyrosine is involved in the synthesis of dopamine. Acetylcholine is the neurotransmitter released at the neuromuscular junction, which stimulates contraction of skeletal muscle. Taurine has many biological functions in the cardiovascular, muscular, and nervous systems, as well as others.
Which of the following symptoms would be most likely to present in a patient with a biotin deficiency? A. Thyroiditis. B. Alopecia. C. Nausea. D. Edema. The answer is B. Alopecia. Biotin, or vitamin B7, plays an important role in the health of the hair, nails, and skin. Deficiency generally manifests as alopecia, loss of hair color, brittle nails, and dermatitis. Nutritional intervention may include all of the following except dash. A. Admonishing patients for dietary indiscretion. B. Diet prescription or recommendation. C. Providing specific nutrient supplementation. D. Initiating tube feeding. The answer is A. Admonishing patients for dietary indiscretion. Offering a treatment plan that includes specific nutrient supplementation and a dietary protocol is a normal part of a nutritional counseling and intervention. Initiating tube feeding is only necessary in cases of anorexia or other forms of malnourishment, but is still within normal procedures. Admonishing patients for their dietary choices, however, would be counterproductive to the nurse's attempt to foster trust and willingness on the part of the patient, and so would be inappropriate in an intervention setting. Which of the following conditions is caused by chronic protein deficiency? A. Pellagra. B. Kwashiorkor. C. Marasmus. D. Beriberi. The answer is B. Kwashiorkor. Kwashiorkor is a condition of sufficient caloric intake with severe protein malnutrition, often seen in impoverished areas where individuals must survive on carbohydrate-based sources of nutrition. This results in a severe deficiency of albumin, with symptoms such as edema, ascites, fatty liver, and dermal ulceration. Marasmus is a condition not specifically of protein deficiency but of general starvation, which may be due to lack of food security or to intentional fasting or extreme caloric restriction. Pellagra is a condition caused by niacin deficiency, and beriberi is a thiamine deficiency syndrome with neurological, gastrointestinal, and cardiac manifestations. Which of the following nutrients can cause hypercalcification in soft tissues when consumed in excess for prolonged periods? A. Magnesium. B. Potassium. C. Niacin. D. Vitamin D. The answer is D. Vitamin D. Hypervitaminosis D, or vitamin D toxicity, has been known to cause calcification in soft tissues due to vitamin D's role in calcium absorption and metabolism. None of the other nutrients are as closely related to calcium metabolism, and do not cause hypercalcification in soft tissues when overconsumed. Methylene tetrahydroflate reductase, MTHFR, deficiency results in the inability to perform which of the following metabolic processes? A. Methylation of folate. B. Homocysteine remethylation. C. Methylation of vitamin B12. D. All of these. The answer is D. All of these. Methylene tetrahydroflate reductase, MTHFR, is an enzyme with multiple important metabolic roles, including the methylation of folate, vitamin B12, and homocysteine. MTHFR deletions can result in folate and B12-related anemias and high homocysteine due to interruption of homocysteine recycling into methionine. Which of the following is an essential amino acid? A. Glutamate. B. Cysteine. C. Alanine. D. Tryptophan. The answer is D. Tryptophan. Essential amino acids are amino acids that cannot be synthesized within the body, but must be consumed through the diet. Tryptophan is the only essential amino acid listed. In all, there are 9 essential amino acids. All of the following criteria must be taken into account when establishing daily reference intakes, DRIs, except dash. A. ULs, upper intake levels. B. EAR, estimated average requirements. C. ADI, active daily intake. D. RDA, recommended daily allowance. The answer is C. ADI, active daily intake. All of the criteria listed and AI, adequate intake, not listed, must be taken into account when establishing a daily reference intake, DRI, except for ADI, active daily intake, which is a fictitious criteria. Which of the following is the most abundant mineral in the human body? A. Calcium. B. Magnesium. C. Iron. D. Potassium. The answer is A. Calcium. The most abundant mineral in the human body is calcium. It is primarily stored in the bones and the teeth, and makes up half of the total weight of the skeleton. In addition, calcium is present in nerves, muscle cells, blood, kidneys, and various other soft tissues of the body. What is the formula for calculating body mass index, BMI? A. Weight, in pounds, divided by square of height, in inch. B. Square of height, in inch, divided by weight, in pounds. C. Square of height, in meter, divided by weight, in kg. D. Weight, in kg, divided by square of height, in meter. The answer is D. Weight, in kg, divided by square of height, in meter. In standard units, the formula for body mass index is weight, in pounds, divided by square of height, in inch, the whole multiplied by 703.